One of the things we have not heard yet, though, and maybe we will, and I don't know, maybe you have some insight or even insider knowledge about it, is, are we going to see the airlines, for example, decide to buy lots of these Abbott tests, and every time you go to the airport, you would use it, or at big sporting events, or any of the places where life has not been able to go on the way you'd want it to? That would be the real demonstrable way to create confidence in the system. But I don't know whether you think practically that can happen, whether the costs make sense, whether showing up at an airport, if you already have to be there 2 hours or 3 hours in advance, showing up maybe a half hour more because you'd have to take these tests, whether people would subject themselves to these tests. And I know they need to be done in a medical environment. But, I imagine you could also hire doctors and nurses and the like in these other places, no?
Yeah, they can be conducted in an austere setting. You could just hire a nurse or a tech to administer these. It doesn't need to be done in a medical office. Right now, the government seems to have cornered the market on these tests, and they're going to allocate them to nursing homes and schools. So there might not be a lot of supply in the marketplace for businesses to procure them. But there's other big manufacturers, major manufacturers, working on these lateral flow tests that should be coming on the market soon as well. Typically, when FDA approves or authorizes something like this, they do it in waves, if you will. And so you see multiple products from the same genre come onto the market pretty much at the same time. So I would expect to see some other authorizations behind this, getting more supply into the market. And yeah, Andrew, I think it can be used like that. I think this allows testing to get into different kinds of setting, effectively democratize testing, move it into the workplace. And eventually you're going to also see tests that are marketed directly to consumers that are authorized by FDA that you could test yourself at home. The stumbling block on that has been requirements that the results have to get reported to a public health authority. But FDA seems to have backed off that mandate. And what they said on a call last week with stakeholders is, as long as the test is reliable and accurate, the FDA is not going to use the requirement to have to report the test result to a public health authority as a way to keep the product off the market, as an absolute condition, saying that the product can't come to the market. And so the rub here is that what they want is the ability that if you test yourself at home and get a positive result, there has to be some mandatory reporting of that result.